Good morning. What would you do if you were faced with the possibility of losing a limb because you have a life-threatening wound that would not heal? Today in the United States, there are 1.7 million patients that have had limb loss. That equates to 1 in every 200 people with amputation. Well, luckily, today, there is a therapy that has been created to assist in the wound closure process that drastically reduces the chances that you will be faced with losing one of your limbs through amputation. Now, traditionally, the method for wound therapy, and this is a method that is widely used today, is called wet to dry dressings. Now, the way this works is that a wet dressing is placed on top of or inside of the wound, and as the dressing dries, it soaks up wound drainage and any debris that is in the wound. When the dressing is completely dry, they will remove that dressing to replace it with another. Now, you can imagine that's a very painful process for the patient because the gauze has stuck to the wound. In recent years, a product was invented to increase the success rate of wound closure. The wound vac is a system that provides negative pressure therapy to assist in wound healing and increase tissue granulation. The wound vac is a three-part system. There's the wound vac itself, the pump, the dressings, and the canisters. The pump is connected by a tube to the dressing, and the dressing is placed either on top of or inside the wound, depending on the depth of the wound. And then the tubing is connected to a canister. Once the pump is turned on, the negative pressure therapy begins. And what this does is it withdraws any fluid and infection that is within the wound and any wound debris. It reduces edema or swelling in the wound and allows the wound to be closed from the inside out. The result is that your body has a greater ability to create tissue granulation or healthy tissue growth. This wound vac system can be used on all types of wound types, such as chronic wounds, or those that will not heal, traumatic wounds, which can be as a result of a trauma or a surgery, acute wounds, dehisced wounds, pressure or diabetic ulcers, and so on. Now, recently there was a study of 342 patients with an average of 58 years old, and they had foot ulcers. And this was a 112-day study comparing negative pressure wound therapy to the traditional wound healing methods. The study concluded that 43.2% of those patients that were on the negative pressure wound therapy system were 100% healed within that 112-day time period, compared to 28.9% of those patients that used the traditional method of wound closure. Let me show you an example of a foot ulcer, or a venous stasis ulcer, that was healed with wound pressure therapy. Now, this image shows the way the wound looked when the patient first met with their physician. The physician did attempt to use the traditional method of wet to dry dressings, and after 3 weeks, it looked like this. Now, you can see that the tissue within the bed of the wound does look healthier and the infection has been reduced. However, the wound size has not been reduced in any way. So at this point, the physician placed the patient on negative pressure wound therapy, and after an additional 3 weeks, the wound is completely closed and new healthy tissue has been formed over the top of the wound. So you can see this is a very beneficial therapy for the patient, and they were able to go back to their way of life. I'm going to tell you about a patient by the name of Dr. Bob O'Connor. Dr. O'Connor is a college professor at St. Mary's University here in San Antonio, and he fell off of a retaining wall which required stitches in his shin. Now, unfortunately, those stitches and the wound became infected, and Dr. O'Connor was placed into the hospital for a week. After a week, his doctor put him on a portable wound vac system and allowed him to go home. Now, because the unit was portable, Dr. O'Connor was able to go about his daily life, and with the therapy working, it allowed Dr. O'Connor to go back to work within a week. So you can see the benefits of the wound vac therapy system. And in conclusion, remember that if you or a loved one are ever faced with a life-threatening wound that will not heal, remember the benefits of this therapy and talk to your doctor about the possibility of receiving this type of wound therapy.